Well, we are so excited to have you on today to talk about personally my favorite topic ever, which is fertility. So it's very exciting. And you are a board certified OBGYN. You educate so much in the space of fertility. Can you talk to us about why this subject matter is so important to you and maybe why it's personal to you?
Absolutely. So I'm a board certified OBGYN and I'm a reproductive endocrinologist. So besides OBGYN, I did 3 years of infertility and really hormone training. That's what reproductive endocrinology is. It's like hormone experts. But my road to become a fertility doctor was not exactly a straight path. I always wanted to be a physician, loved the whole diagnostic challenge, and I actually started my career in emergency medicine, which was great. I have so much respect for every ER doc that's out there, but I very quickly realized I wanted to be much more in the weeds. I wanted to understand the patient's journey. I wanted to walk with them longer, see them to the end of the problem. And I loved that diagnostic puzzle. So, kind of quickly, when I was leaving emergency medicine, I thought, women's health and hormones was really a huge draw and getting to follow people through a problem. And infertility is truly the, extreme example of that. I get to really be a part of my patients' stories. But I was drawn to it for the medical facts because I love the hormones. I love the puzzle. Like that's just so fascinating to me. But during my own training, I had 4 pregnancy losses and got diagnosed with unexplained recurrent pregnancy loss, which I found devastating. I really found myself into this unique position where I was an OBGYN. And yet all of the questions I had, like, am I timing sex right? When am I really ovulating? How is my luteal phase? Like, what should I be eating? What should I be doing? Can I decrease my chance of miscarriage? Should I be taking an aspirin? Like, I didn't know the answers to any of those, yet I was one of the experts because medicine, today's society is so reactive, right? We wait till you have a problem and then we work up the problem and we treat the problem. And especially when it comes to your fertility, I mean, the definition of what I do, infertility, is you have failed to get pregnant. And now we will do an evaluation to see if everything is working. It truly blows my mind that we don't live in a more preventative world here when it comes to something that so many people would say is a life goal of wanting to have a child. And so going through that experience myself as a patient, being told there's nothing you can do, it's just bad luck, feeling like I was being, dismissed myself really changed both how I viewed the patients on the other side of the table, how I really connected with what the experience was like, but also this deep desire to say, I love IVF. I do IVF every day. There are some patients who will always need IVF, and I get to walk that road with them and make it easier. But that there's got to be more to before we get to that stage. Like, can I reach patients at an earlier phase of their journey and help them sooner and say, how can I make this easier and educate them earlier? And so I really started doing research on natural fertility and our environment and our bodies, even back in fellowship. It became such a passion. And that's why I started even talking about it online and getting us to where we are today, because every day I sat across from amazing, accomplished, successful women who said the same thing. They said, why didn't we know this sooner? Nobody's ever talked about this. And so that's really what has driven me to have a louder voice than just the patients I can see in my clinic, but really try to spread this knowledge online.
Oh, I am so passionate about everything you said. I know, Ken, I have millions of questions, but this is why we love you so much and all the content and work you're doing. It's so important. And one thing you mentioned, and this is something I'm in my fertility journey. I'm learning so much. So a lot of what you said really resonates with what I'm learning about, even on my own journey. And I think about what is one thing I wish I did earlier, right? I'm in my mid 30s. I'm beginning to think about having children. So I'm curious from your perspective, if there's a woman listening today, what would you advise them to check or just be knowledgeable about, even if they don't want kids anytime soon, but it's just a good thing to kind of be proactive about? Because I did not think about any of that.
I could talk about this one question for an hour. So let's try to hit it at a high point. I think number one is going to be, I'm going to preface this. This is against medical recommendation, meaning right now, the current medical societies do not recommend what I'm about to say, but I feel very passionate about it, is that if you think you want to have kids one day, you need to make sure that when you see your doctor and they say, what do you want for contraception? That you also say, hey, I'd like to have kids one day. Can we see if I'm running out of eggs? And the reason why is that some women will run out of eggs at an earlier standpoint. We're all born with all the eggs we're ever going to have. We lose eggs over time, and everybody will eventually be out of eggs or in menopause. But along the way, there are very few signs that anything is wrong until you're really kind of at the end point and don't have many eggs left. So you can have blood tests done to give you an idea of where you are. The most common one is called AMH, or anti-Mullerian hormone, simple blood test. AMH is not going to tell you, are you fertile? Like, oh, everything's okay. It's not going to tell you if you're infertile, meaning people can have an AMH of all different numbers. It's telling us how many eggs are available right now. As long as you're still ovulating, you can get pregnant. But it can be a red flag or a warning sign, meaning it can give you the opportunity to intervene sooner or to start to work on getting to a, well, why do you have a low AMH, right? If a young woman who's not trying comes in, finds out she has a low AMH, I'm not just so dismissive to say, oh, AMH doesn't mean you can't get pregnant naturally. And it's a true-ish fact. But I always say, but why is it low? There's things that can cause a low AMH, like endometriosis, that do in fact make it hard to get pregnant naturally. So I think medicine's taking a little bit of a simplistic view on that one. And for patients, you have to be your own advocate. Very few, and I see my colleagues who, are general OBGYNs who are seeing women for their annuals, who are really trying to be more proactive about it. But I think if you know kids are a life goal for you, you've got to say, even if you don't want them yet, okay, maybe I should get my egg count checked, because if it is low, why is it? Or maybe I would freeze my eggs, or maybe I am in a committed relationship and I could have them sooner. I'm just not. I mean, that could have been my case. I mean, my husband and I have been together over 20 years. We could have started trying for children at a much earlier time had I known the road would have been so much harder. So I think if you know that that's something, you can get fertility testing. You don't have to wait for your doctor to bring it up. You can also call and see a fertility doctor for fertility testing or to talk about egg freezing at any moment. And not that egg freezing's the whole enchilada here, but I think this is one piece of the puzzle that I've seen so many women say, well, my doctor never brought it up, so I figured that I didn't need to think about this yet. And then lo and behold, maybe they do find themselves in a harder position and they wish they'd known that information sooner. I think similar to that is going to be the best way for you to understand that your hormones are, we're going to say, balanced. Balanced hormones for me mean that your hormones are communicating effectively. Your brain interprets what's happening in your body and can then send out the right hormone. Your hormones are a dynamic system. They're very complex. But if, the three of us went and had hormone panels checked, they should all be different. We're all at different stages of our cycle. The things we've done today, what time we got up and when we ate and if we worked out, every hormone should be different in our bodies. So it's very hard to go get a panel drawn to check a hormone imbalance. But some of the best signs that we have are actually going to be your menstrual cycle for your reproductive hormones. Is your cycle regular, predictable? Do you know when you're ovulating? Are you having abnormal bleeding? Are you having abnormal pain? Are you having, abnormal length to your cycle that's really varying? That's how your body gives you clues that something could be wrong at an earlier stage that you want to get investigated. And so I always say, if you're not on any type of contraception, I give you a calendar, you should be able to put your finger on when your next period is going to start and be right within a 1 to 2 day variance. And so if we're not having that, we're really varying more than that. Those can be those subtle signs, kind of that first tier of ovulation issues or things that might be going on. And I think that so often this is a hard one for women because they might be on hormonal birth control, or maybe they have an IUD in place and they've lost that signs. They've lost that ability to, at a younger age say, are my hormones working? And that's okay. I mean, proper contraception is very important, especially in today's world. I never want somebody to get off hormones and then find themselves in a bad position when it comes to an unintended pregnancy. But I think that there's merit to say, if you're curious about this, should you take a pause in your birth control pill for a few months and see, are your cycles present? Are they coming back? I once had a patient who I saw very young, was in her 20s, and she was an ovarian failure. She was totally out of eggs and she was in her 20s. And she had had a moment where in college, she actually went off the birth control pill and didn't have any periods and went to go see her doctor and was told, oh, it's normal, no big deal, just go back on the pill. And for me, I always hated this conversation with her because she was said, well, Could we have found this out then or made a difference? And I mean, we don't know, but maybe, right? So you could always take a little bit of a pause if you have either, you're in a position to protect yourself otherwise, or use condoms, or you're not having intercourse, so you don't have an unintended pregnancy, but to be able to understand that. And if you're not in that position, make sure you stop contraception well enough in advance of when you want to get pregnant so you can detect those abnormalities earlier and get an evaluation done. But more than some of those things is to say, your eggs are in your body your entire life. And this is so different than for sperm. Men make sperm every single day, every single second. One change that they could make in their lifestyle, the sperm 3 months from now will have never seen the old thing that they did. But for women, our eggs are inside our body and they absorb the wear and tear of our life. And so your fertility is really tightly correlated to a lot of different factors in what your body is exposed to when it comes to inflammation and toxins. This doesn't mean that you can never have fun or never do anything, but we really have to look at the fact that the sum of all of these choices that we make every single day that might seem like they're not a big deal on a one-off, they all add up together. The integrity of our gut health, the quality of our diet, the amount of sleep that we get, the toxins that we are exposed to, these things all can add up together to create chronic inflammation, which can in turn make our egg quality worse and make our eggs have less ability to kind of have metabolic function, essentially to divide normally. So I think that in the perfect world to say, I'm not going to worry about this till I'm older, that's not my favorite thing, of course. But to say, you know what's good for your health is good for your fertility, right? Like I'm going to focus on eating healthy and doing these habits because I'm going to feel better. My skin is going to look better. I'm going to have more energy and it's going to make my eggs healthier as well. And I think that we don't say that piece of the puzzle, but I think it's an important piece because for many people, that is a life goal. And think about how we plan our other life goals, right? I'm going to make a game plan. I'm going to work hard. I'm going to study. I'm going to do all these things to get to this goal. Yet we don't approach fertility like that. We say we're going to prevent pregnancy all the way until one day, oh, suddenly now I want to try to get pregnant. And now we're going to shift gears. And we so often find ourselves unprepared for what that side of the journey looks like.
Oh my gosh. I love this. This is amazing. This is like my favorite thing. I swear. I'm have 50 million follow-up questions.
I love it.
Okay. I want to start at the beginning because Yasmin and I are at the stage where pretty much all of our friends are thinking about this, dealing with it. I want to know, in your opinion, kind of looking at this, we kind of keep hearing, oh, infertility is on the rise, or more and more women are struggling with ovarian failure or going into menopause early, maybe even in their 20s and 30s sometime. You being an expert in this, is this the truth? Is that really what's happening?
Yes, that is the truth. We have seen an increase in the rate of infertility. If you are trying to get pregnant for the first time in the United States right now, your rate of infertility would be 1 in 5. A decade ago, we said 1 in 8. And those are startling increase in numbers. Over 50 years, we've seen a 50% decrease in sperm counts. We have seen a decrease in egg quality and egg counts in young women. And this is not just coincidence. It's not just coincidence that all these things are happening, right? At the same time, we're seeing an increase in the rate of chronic inflammatory disease, autoimmune disorder, toxins in our world. We think about the modern lifestyle, how different it is than what people did 40, 50 years ago. And I think we really have to acknowledge that inflammation is such a big key in contributing to our health as a whole, but especially to our fertility. So we also couple that with the fact that, yes, people are waiting longer to get pregnant. And yes, people are talking about their fertility, which is wonderful because infertility is such an isolating experience. And when people are talking about it, that is going to bring more light to the subject. But we do have real data saying that this is increasing as well. So it's not just that, oh, women are waiting later, because we're seeing changes even in young women and incidence of disease and what's happening to their eggs.
I was listening to a podcast where two women were sharing about how they went into early menopause in their 20s. They were diagnosed. It actually might have been 3 women. And one thing that I did notice in all 3 of their journeys, that all 3 women had been on birth control, hormonal birth control, prior to finding out this information. I've seen you post a lot about myths around birth control. We talk to a lot of experts around birth control. So is there anything that you want to add to that conversation? Is there something going on here, or we just don't know?
Great question. Hormonal birth control does not decrease your egg count. It does not cause you to go into ovarian failure. Even the example I said about the patient I had in her 20s, and she was on birth control, but the problem with birth control, and her case is a good example, is that it doesn't allow us to get the signs that something is going wrong, and we miss that, for lack of a better word, what we call diminished ovarian reserve or perimenopause. We miss the interval of when we can intervene because we are on hormonal contraception. So we've lost the clues that our body is trying to give us. Couple that with the fact that so many women are put on birth control at a younger age without any diagnosis, even though they have a true medical problem. We see a slew of women coming off the pill having issues with their period that they were never able to find out what was really going. And it really makes birth control the villain. I think it's important to also reshift and say birth control is a medicine. It is, estrogen and progesterone. There are medical indications for it. And one thing I hate is that villainizing hormonal contraception online has left people who are in a true medical diagnosis where birth control could help them be very fearful of what that could do. And that's a huge disservice to women who maybe really could benefit, whether it's from, PMDD or terrible PCOS or painful endometriosis. And the pill might actually be something that could change their quality of life dramatically, but now they are afraid of it. We do know that the birth control pill does not cause rates of going into ovarian failure early, does not cause infertility. It does not cause you to have a drop in your egg count. I will say this. If you check your AMH while you're on hormonal birth control, it can be temporarily suppressed because your body's not ovulating. The same thing is true if I check your AMH and you're pregnant or you're breastfeeding because you're not ovulating. So whenever you're not ovulating from a suppression standpoint, so birth control, pregnancy, and breastfeeding are all due to hormonal suppression, the cells that make AMH are not going to be quite as active. I check AMH on women on birth control all the time. And all I say is, hey, we're going to check this. Probably it's going to come back normal. Great. If it comes back low, however, we're going to have to go on an investigation to see, is it low just because of the hormonal contraception, which would be transient and temporary. So we're going to come off of it, check again in 2 or 3 months and see how things are. Or is this a real factor that, now we have to evaluate? But we do know the pill is just working on the brain. It tells the brain not to send out FSH or LH. Therefore, you are not ovulating. The birth control pill does not work on the ovary at all. So it's not impacting egg count or ovarian function. And I think that that's a myth that I see all the time, that it's causing you to run out of eggs, or I've seen the opposite. You're saving eggs because you're not ovulating them. Neither of those are true. Your body loses a group of eggs every single month, no matter what, from before you're born. Eggs come out of what I like to think about the vault in your ovary where all your eggs are kept. Every month you have a group of eggs outside the vault. One of these is going to ovulate, the rest of them die. Months that you're not ovulating, whether it's birth control, whether it's pre-puberty, whether it's pregnancy or breastfeeding, eggs still come out of the vault. They just all die. Next month, another group. So the birth control is only changing that ovulation standpoint. No eggs getting stimulated to grow or ovulate. They still came out of the vault. They still died. Next month, another group. So I think that that's a myth that I'm seeing across the board that I've seen women have terrible impact of. I've seen women with PCOS who maybe could have been on or should have been on the pill and they weren't, develop endometrial cancer, have these terrible outcomes. And when we talk about it, it's fear. It's online misinformation that's causing them too much fear.
And I'm curious, I wasn't aware of this about shifting your AMH. So you said that it can dip temporarily if you're on birth control. Let's say you're off birth control, you want to test it. It might be lower than you wanted. Are there proactive things you can do to shift that number, or is that just...
Yeah, this is a great question. AMH is made from the cells that surround every egg outside the vault. So by definition, it is not a true measurement of every egg that you have. It's a measurement of the eggs you have available this month. And we know that month to month, there's going to be some month to month variation, right? Like our bodies are not perfectly going to send out the exact same number of eggs every month. That can actually vary by 20 to 30%. Just randomly month to month. So if I check your AMH every single month, it's going to hop around a little bit. Over time, if I step back in everybody, the average of that curve is going to drop and eventually we'll be out of eggs. So we don't recommend checking it that frequently because it becomes very confusing. But I think a couple of things are important to know. Number one is going to be, anything that, temporarily suppresses it should go away. So just by repeating a value or getting another month's look, we should see a different outcome to be able to get to the truth. We also like to combine a low AMH value with a further test called an antral follicle count, which is essentially an ultrasound determination of your egg count. We never want to make this huge accusation off just like one little blood test. So we always want to see what's actually happening in your ovaries to get a better idea. A lot of the changes we can make in our lifestyle are going to be a lot more focused on our egg quality, the chromosomal complement, or the inflammation that our eggs are impacted. But there is some evidence that, if your body's under, we'll say, a lot of stress, a lot of inflammation, you also may not be quite sending eggs outside the vault to the extent that you want. I like to think about inflammation, we'll say in general, let's call it interference. It's like static interference in our bodies. And so both our ovaries and our brain are not interpreting signals quite the best that we want them to be able to do so. And so part of the reason why we're really focusing on decreasing inflammation is so that our brain can really interpret what's happening in our body, can say, oh, okay, that's what's happening. Now I can respond. Also, so that we don't have our chromosomes inside our eggs be subject to more inflammation, which can cause more chromosome damage. So if we find out that we're in a position with a low AMH, we always want to get further testing, which is usually with an ultrasound. If it's truly low and especially if we're really young, we're looking for causes why. Is it autoimmune disease? Do you have a genetic disorder that could be causing this? Underlying factors like endometriosis can cause a low egg count. Smoking cigarettes can cause it. You actually can go into ovarian failure earlier if you smoke. So that's why every fertility doctor says a big no to that one. But thinking about if we can get to the bottom of, 85% of the time we can't. Everything's normal when we check for a low egg count. And I think that's a little bit attributed to some of these things are very hard to diagnose, like endometriosis itself can take 7 to 10 years to get to a diagnosis. But I also think this is a lot to do with the world around us. And a lot of the factors, there was just a study published recently saying, that these forever chemicals, perfluorinated chemicals coming out, impacting ovarian reserve and women, having a lower ovarian reserve with higher exposure level to PFCs. And that's not the first study like that. We've seen that with BPA. We've seen this with other environmental chemicals. So we definitely know that your egg count, although it's a dynamic process month to month, that there's some portion of what you're exposed to that is impacting it. So there's a genetic component you're inherited with, you're born with the eggs you're going to have. Some of this you had zero control over, but there is an environmental component that is both the world around you and how you treat your body that can influence this as well. And that's the part that we can control. We can't control the deck of cards we were dealt with, but we want to make sure that we're at least not adding to that or making it worse by increasing those inflammatory levels or toxic exposures.
And in your book that's coming out soon, do you talk about, which is very exciting, the fertility formula? Is that right?
Yes, I'm so excited. Finally.
Yes, very exciting. And we're going to be recommending it to everyone we know. Do you talk about proactive ways to kind of tackle this systemic inflammation that we're exposed to?
Absolutely. This is probably, in my opinion, it's why the book exists and why it's different than, run-of-the-mill books that are out there. In addition to walking you through all these facts about your body that I wish people would have known earlier when it comes to how your body works and your hormones and what you should know if you're trying to get pregnant or if you have an abnormal cycle. Really, in all of these chapters, also talking about how inflammation in the world around you impacts and causes changes to all of these normal processes. But then half the book is more than that. It is about your lifestyle and a deep dive into the data that talks about systemic inflammation, what you can do to mitigate it, down to like the nitty gritty, vitamins and supplements and exercise and sleep and stress and your diet and your environment, and then gives you a really actionable plan because it's really overwhelming. The idea that so many of us, I'm putting myself in the camp, have shown up at a doctor's office with infertility and been told there's nothing you can do. The truth is further from that, right? You may not be able to overcome it all on your own, but there is a lot you can do to set yourself up for success. And in the perfect world, y'all, I would have somebody have this book, well before they wanted to conceive, right? They would be able to know all of this ahead of time, really take a more proactive approach. That's my hope long term, is that this becomes something that we say, oh, I'm in my 20s. I'm going to read this book now and then reference it back later if I need it later on, but really be able to incorporate some of this in their life. But It's also made for the person right now. So maybe you are trying to get pregnant right now, or maybe you're in the middle of IVF and you want to take control of that uncontrollable situation, know what questions to ask, what tests should be done, what you should be doing with your own lifestyle at home. So it's really giving you the plan and working you through that as well. And I think that's what really sets it apart, is so often we see doctors, especially in the IVF space, not talking about fertility and not talking about inflammation. It's more than a book of facts. It's really giving you a prescriptive approach to say, how am I going to tackle this problem now and make a difference?
God bless doctors like you. I will never forget. I walked into a fertility clinic to check everything, right? I'm learning, okay, be proactive. Let's see what's going on. And another doctor came in and was like, "How old are you?" And I was like, "I'm 36." He's like, "Don't waste your time. Go straight to IVF." He knew nothing about my blood work. He knew nothing, right? Nothing. And he just came in, said that, and left. And I was like, and it killed me, because I feel like I have people around you who think more proactively. So I'm in this bubble that I've created. I'm like, oh my God, this is what people are going through. And what you were saying about them just saying unexplained infertility, I cannot tell you how many friends who now have kids, they're like, I don't know what happened, but they always said unexplained fertility. And that, I'm like, how is that real? So you kind of mentioned in the beginning, is that a real medical term? Or
let's say yes and no. It is a real medical term, okay? Unexplained infertility means that we have tested the top causes of infertility and they are all normal. So this means you have normal anatomy, normal uterus, normal fallopian tubes, you ovulate regularly, you are not out of eggs, and the sperm count is normal. When all of these things come back true, you get grouped into this camp called unexplained infertility. Truly, I always say it's not really unexplained, it's undiagnosed. But a lot of times this is because the diagnosis is hard. It's not easy. It might be invasive. It may be something there's not an easy test for. Now we have a lot of literature on unexplained infertility as a group, meaning, okay, well, you don't meet these categories, you meet this one, and what treatments work or what things are more likely. I'm a big believer that unexplained infertility, chronic inflammation is a big underlying cause for a lot of the things we see at play. We see endometriosis and adenomyosis. We see poor egg or sperm quality. We see implantation issues. A lot of this is stuff that we think inflammation is really playing a role. And, two things can be true at one time, right? IVF might be the thing that's going to give somebody the best chance of conceiving, but that doesn't mean that we don't also want to, level up our playing field by decreasing our inflammation as well. And I think we see this. I'm sure you have a story of a friend who went in and was told IVF was the only way they'd get pregnant. And they got pregnant on their own, and even when I tell patients, who might have unexplained infertility, I might say, oh, the odds of success are low. Maybe they're 2 to 3% in your case. I always say that's not zero. It's not zero, right? You can still get pregnant. It's not a very effective way. Globally, we want to think about how old we are and how many kids we want and how important this goal is, because 2 to 3% doesn't necessarily feel like it's going to happen. And we might want to kind of change the odds in our favor, but it doesn't mean zero, especially when we don't know the true diagnosis for what's underlying it, right? That's very different than if you are both your tubes are blocked or there is no sperm, right? There are some definitive diagnosis that might change that. But unexplained is a really hard one. It's I've been there. It's very unsatisfying as a patient to be told that, because humans are wired to want answers. And I think you have to exist living in the gray. And how I approach patients is, if you have unexplained infertility in my brain, we are going to approach it like you have a chronic inflammatory disorder, otherwise not identified, but there is something going on. And maybe it's autoimmune and maybe it's not. And we're going to walk through the ones that we can. We're going to test for ones that we can that are easier to test for and try to see if we can get there. But if we can't, we're not going to be like, oh, everything's normal, carry on. We're still going to make decisions from a mindset that something's not normal, because that's really what your body's telling us.
It's so also just a few things that you mentioned there. It's so disempowering to hear unexplained, right? And everything you mentioned, the 5 criteria were more structural or physical. I mean, is things like thyroid abnormalities included in there? I mean, I'm just thinking of all of the things that could possibly be going on with someone that could help them. One of my really close friends, and this is so different for everybody. Let me just preface by saying everybody's so different. was trying to get pregnant for a while, and getting on the right thyroid medication was the trick for her, right? So like it could be so many different things.
Human reproduction is, every day I'm amazed people get pregnant without intervention because there are so many things that have to be exactly right? An egg only lives for 24 hours in your body, right? It's like this very short time frame. I mean, sperm can live for up to 5 days. So that's why the fertile window is, the 5 days before and then the day of ovulation. Things like your thyroid, right, play into how your brain interprets your other hormones. Your body, and the way I like to simplify it is, your body has no idea what's happening outside your world, truly. Your brain is like air traffic control. It is just interpreting the signals that's coming at it. They're not actually out there flying the plane, but just trying to make good choices and decisions for you. And if everything that's coming back is like high alert, stress, intense, this is terrible, it's going to get really chaotic and it's not going to be able to send out other good signals appropriately. And what we start to see is that our bodies really start to function based on the world that we're giving it. And when it comes to things like unexplained infertility or these anatomical things, thyroid plays into how your brain's interpreting the world around you. So does prolactin, right? So do other hormones. We can take herbs that actually totally interfere with our hormone receptors in our brain, and we can be muddying the water, even though we're trying to be really well-meaning, which is so frustrating. But I think when it comes to things like that, that's hard. It's a great point. Thyroid often impacts ovulation a little bit. I find a lot of people will get their thyroid diagnosed when they have like obviously irregular cycles. Oh, I'm skipping cycles. I should go get this checked out. But a lot of your subtle hormone abnormalities, whether it's thyroid or prolactin or testosterone, actually cause a shift in your cycles that you may not even be aware of unless you're tracking when ovulation occurs. So unless you say, oh, my luteal phase is short, which you only know if you know when your ovulation's happening in context of your full cycle, that's usually one of the first signs of an ovulation disorder. We know, so prolactin's a hormone made from the brain, and it's really known to be like the lactation hormone, typically only high when you're breastfeeding. But as prolactin raises, we see a very specific change of ovulation issues. Your body goes from perfectly regular periods to a short luteal phase to having a longer follicular phase and a delayed ovulation, then starting to have irregular skipping cycles and then not ovulating at all. And as you treat prolactin, it goes back down. You go back through all those stages of ovulation disorders. So I always say this first kind of subtle change that can come from a variety of different things is actually may not be irregular periods, right? It might be a subtle shift in the cycles of your period that you could be totally unaware of unless you know your cycle and you know your body. That's why we say, hey, your menstrual cycle is a vital sign. It's really telling you about how your hormones are functioning, but you have to know how to track it and how to use it.
I love that. And we are such huge advocates of tracking your cycle here. I mean, I'm like a little nuts. I figured out when I was ovulating a long time ago.
This is
before I
great.
wanted to get pregnant.
Amazing.
I was like, I know exactly what's happening to my body at this moment. But I want to talk about that because I don't think a lot of people do understand when their body is ovulating, or even if they are ovulating. So you talked about how your period can give you some signs. Let's talk about ovulation. How do people know if they are truly ovulating?
Okay, let's spend 2 minutes talking about what happens inside your body for ovulation to occur. So we already talked about how you've got a vault where all your eggs are, and every month you can have a group of eggs that are outside the vault ready to be selected. Each egg grows inside a follicle, which is a fluid-filled structure, and you can see the follicle on ultrasound. But the brain sends out follicle stimulating hormone, or FSH, which is well named to get a follicle to grow. As the follicle grows, estrogen is made, egg matures. That's the first part of the cycle called the follicular phase, named after what's happening in the ovary, follicle growing. That is an estrogen dominant phase, meaning you're making estrogen only. There is no progesterone around at all. You are growing an egg. When your estrogen level gets to peak levels, that is the signal to the brain that the egg is mature. The brain has no idea, it cannot see the ovary, right? Like there are no eyeballs telling the brain what's happening in the ovary. It is only waiting for the signal, which is estrogen. When estrogen's been 200 picograms for 50 hours, that's a very specific amount. The brain now says, oh, I've seen a high enough estrogen for long enough. I know there must be a mature egg. And it's going to send out a surge of LH, or luteinizing hormone. This allows that follicle to rupture, allows the egg to come out, and that is ovulation. And then the egg is going to reform and become what's known as the corpus luteum. So now your follicle is called a corpus luteum, and it transitions into really a hormone producing factory, but now it makes progesterone. So this, after ovulation, this half of the cycle is called the luteal phase. Luteinizing hormone, or LH, is coming from the brain, stimulating that corpus luteum to make both progesterone and estrogen. Actually makes a ton of hormones, but we talk about progesterone and estrogen the most. And these are actually now made in pulses. So your progesterone's made in pulses, as LH pulses are coming from the brain. So it can vary at any moment throughout the luteal phase, but you have progesterone present. And that corpus luteum can only live about 2 weeks. So we really love that corpus luteum to last for at least 12 days. When we see luteal phases that are 11 days and less, that's what starts to be a little bit on a shorter side. That can be a sign that the corpus luteum did not last as long as it's supposed to. But after about 2 weeks, corpus luteum is going to die. Progesterone levels are going to drop. That's the signal to the uterus that, hey, we didn't get pregnant this month. Let's have a period. And the cycle restarts all over again. So when we think about like what is happening from that end, the way that we track our cycle is all based on what we call fertility awareness methods, or looking at the signs and the clues that our body is giving us. I will say that a lot of our apps are based on what we call the simple calendar method, which is, hey, based on the premise that the corpus luteum lives for 2 weeks or 14 days, I'm going to take your cycle length. If you have a 30-day cycle, I'm going to subtract 14 from it. And I'm going to say that you ovulate on day 16. I'm going to say that your fertile window is the 5 days before then. And poof, that's what your app is going to give you as your fertile window. Well, apps aren't always great at this. We know a lot of apps can really miss when the fertile window is completely. It really depends on if they adjust their equation based on what you're actually giving it as your cycle links. They're usually set as a 28-day cycle, which only like 13% of women have a 28-day cycle on average. So it's really interesting how so many people will just use their app. I just have sex when the app tells me to, and they're not actually using any of their fertile signs. Now, there are some apps that combine tracking and fertile signs, and those are different, right? Those are using two different methods. So when we're using an app or some type of tracking method that is combining calendar and fertility awareness, then we are getting to higher sensitivity or better detection. Fertility awareness tracking methods, like we said, so number one, my favorite method is cervical mucus. And this is one freaks people out because they don't like to talk about their cervix, or they think they have to do something that they don't. Your cervical mucus is the barrier at the cervix that is protecting the uterus from what we call ascending infection, anything getting in the uterus that shouldn't be there. So it changes though with how much estrogen and progesterone you have. So what we see is that in the follicular phase, you'll go from having really no mucus to then you'll kind of get some creamy mucus, and then you get sticky, stretchy egg white mucus right around that peak estrogen level. And that is so that the sperm can more easily swim through it. And then after ovulation, you're going to have that completely change where you're going to have no cervical mucus at all. And so the cervical mucus has different types based on the estrogen and the progesterone. Well, you don't have to do anything crazy to check it. You can actually just wipe externally before you go to the bathroom, look at the toilet paper and see what is there. And that is, there's no fingers have to go inside, nothing funny about feeling your cervix. You're just looking at what's coming out. And if you're trying to target when ovulation is, it's when you have that type 4 cervical mucus. So that one is free and easy and pretty simple to interpret. And I love it. Basal body temperature is another great one, but it's based on the premise that after you ovulate, your corpus luteum makes progesterone, and progesterone raises your core body temperature by 0.4 to 1 degree Fahrenheit. So that's awesome to confirm that you did in fact ovulate. So when you first start using BBT, we're looking to see when you have a shift, and then that is confirming that ovulation occurred. If you have very regular, predictable cycles, you can use this then to be predictive in the future, but it's not very predictive in the moment. Some apps do, like Natural Cycles does a great job of combining your tracking with your calendar and your BBT, and they've made BBT simpler by using wearables, like by working with an Oura Ring or an Apple Watch. And that makes it a little easier because previously it's very tedious with a thermometer before you get out of bed, before you drink water, having to chart it on graph paper. That could just be a little bit harder. So we do see some app technology making it a little bit easier for BBT tracking. I love that one as a confirmatory method. Like, I think I ovulated here. Let me see that I did, in fact. But it's a little bit harder predictively, especially if you do have a little variation to your cycles. And then we have ovulation predictor kits, or OPKs, which are an LH urinary based detection system. And so this one's trying to capture when your body first sends out that LH surge. And it's much like a pregnancy test where you pee on it once a day. I will say for OPKs, I want you to use them between 10 a.m. to 2 p.m. The box will say use with your first morning urine, but OPKs are checking LH, and LH is released from the brain in the early morning hours. So it has to get metabolized through your kidneys and get into your urine, and it might not be there yet if you're using it with your first morning urine. The box says that because it doesn't want your urine to be too dilute, which of course that's an issue too. But I find that midday is going to be the better time because we want to give your body time to have the LH surge there. LH surge happens before ovulation. So we feel like the positive OPK date is the day before you ovulate. And if you're trying to get pregnant, what we want you to do is try to time intercourse when you have the positive OPK that day and the day after. Or if you're checking cervical mucus, any day where you have that type 4, which is that stretchy, sticky egg white mucus, that's when you want to target for your ovulation.
So wild that like nobody teaches women this, right? Like a lot of women have no clue until they have to start. Maybe they're trying to figure out why they're not getting pregnant. Are they ovulating? Whatever it is, like, we only know about this stuff because we're saturated in this world. But if you're not, then it's a mystery.
Most people actually do not start tracking their cycles unless they're having a problem, right? Like the vast majority of people will stop preventing pregnancy, whatever that means. And then they're going to do this. We're not trying, but we're not preventing, and hopefully we'll get pregnant. We don't start tracking until we say, hey, what's going on or what's the problem? And I really wish, if in my perfect world, we're doing that all sooner. It's not that you have to track to get pregnant, right? If you have frequent intercourse, like you don't have to track, you just have sex. But it is such a tool to understand your hormones and your body the best. And in a world where we just are in such a deficit, we're really trying to catch up and understanding how our body works. I wish more women would start to use that tool earlier just to truly catch these problems faster and get an evaluation faster.
And I love what you said earlier in the podcast, because this would have motivated me early in my 20s when I wasn't even thinking about kids. It's like, you might not want kids anytime soon, but having a normal cycle is your fifth vital sign. Like who doesn't want to feel better, more energy, have no cramps, better skin? Like that is very motivating, I think, when you're younger, because I was not thinking about kids like at all. I knew it'd come one day, but it's like, just to be mindful about your period. There's so much information there, which I'm like, thankfully that finally kicked in late 20s, but that is, I think, really important for women just to start thinking about. And like you said, just tracking is like the first step. So many people don't even track their period, and it's free and easy and can show a lot.
It's so easy. I mean, you don't even have to use an app. I mean, just at a minimum, mark in your calendar, pay attention to the signs your body is giving you, because your world is going to be a lot easier if we can catch some of these issues faster, whether you want to get pregnant or you just want to live a hormonally healthy life. And I do talk about that in the book some. Like, these tools can be used to get pregnant, to prevent a pregnancy, or just to understand your body. I love that we're seeing such body awareness right now. And that comes by, really, though, we have to educate ourselves first and learn how to interpret these signs that our body does give us, that things are either working or not working.
I know. I also want to talk about sperm. I've you kind of trickled it throughout the podcast, and it's interesting because when you're going through the fertility journey, there's so much a woman has to consider. And you hear some people say like men are 50% of the equation, but I know it's important, but I'm like, women still have to do all these tests and all these things, and sperm can, like you said, rejuvenate every 3 months. But tell me more about sperm's equation, because so much of this is always put on women, and maybe the man is a problem. I'm not sure. Would love to get your thoughts.
50% of the time, there is a male factor at play when it comes to infertility cases. And so it's not just that, oh, they're one half of the couple. It is that truly we see the sperm as that impactful. Now, I think what's really important here is that, yeah, you're right. It's so much easier to evaluate male infertility because one ejaculate is going to tell us how many sperm we have, how they move, their shape. We'll see if there's inflammatory cells in the ejaculate. We get the pH, and it's telling us a lot about how hormones function and how our body status is all in one test. And for women, unfortunately, there's a lot more at play. We have to get a really good menstrual history, like all the cycle stuff we talked about. We want to talk through, if you have any abnormal bleeding or spotting, if you have any pain with your cycles. We want to talk about if you have any tracking data. We then have to test blood work to see, factors that can impact ovulation and your egg count, and do an ultrasound. And then anatomically, uterus and fallopian tube. So there's a lot more testing we do. And what I say is that even though female factors maybe 50% of it too, just the diagnosis is kind of a little bit more divided up, whether it's anatomical or ovulatory. So it is more testing for women. And I hate that online women take and in real life too, women take so much blame so often. He doesn't need to get tested, or he is fine, or it's not him, or the problem is me. And that's just not true. And that's not what data supports, right? We know that both people can have a problem. Infertility is a couple's problem. Not only is it important to evaluate both parties, we also have to approach our lifestyle from both people as well. And I tell every patient this from me, I said, hey, this is a team project. Like, fertility is a team project. We are not going to be just letting one person carry the burden, carry the weight, carry all of it. We have to figure out how we're both contributing. And if she's getting more testing done, then, you're cooking the good food at night. Like, this is a teamwork right here, because really it's a lot on women. It's a lot on our bodies. Even the treatment is much more focused on the female body than the male body. And that's just kind of speaking towards what we have as our tools to try to overcome it. But I don't like that how women are so fast to take the blame and so fast to be the ones to have to do everything, right? They're doing all the shots. They're buying the supplements, cooking the food. They're doing all of it. And I really try to empower, like, what can we do? How can we support? Like, what's your role going to be too? Because sperm is such a crucial part of the equation.
Gosh, and there also seems to be a lot of men that I hear about, I'm not going to get tested. I'm fine. Like, there's no reason for me to get tested. And I think that there's some shame there of, like, what will they uncover? And I'm glad that this conversation is happening more and more, because I think that it will help a lot of men who are either afraid, or they just feel like they don't want to go down that road, or they feel ashamed that maybe it could be them. I'm excited for what the future holds for both parties being involved. I do want to touch on, so much of what people are doing now, which, thank God for these advanced technologies. They can help a lot of people who can get pregnant, but I do want to talk about them because more and more people are using them. I imagine that it's just going to increase over time. I think about my kids, like, is everybody going to be using IVF? I have no idea. So let's first talk about egg freezing really quickly. When is it too late? Who is a good candidate?
Egg freezing is an emerging technology. A decade ago, it was just coming off of experimental status, and we've improved both the technology and the data that we have on it. We used to say that eggs only survive the freeze thaw 40 to 50% of the time. And now in a good lab, we see eggs survive in our lab 95% of the time. So huge difference. It's really incredible. An egg is a single cell filled with DNA, right? And like, we're freezing it and then thawing it, and everything survives and is intact. It's really amazing technology. Now, egg freezing is the first part of the IVF process, right? So we think about IVF or in vitro fertilization. What you might go through, whether you're freezing your eggs or doing IVF, is exactly the same at the beginning. We're trying to get 1 month's group of eggs all to grow and take them out of our body. We're not giving you funny, crazy, weird, synthetic things. We're giving you FSH and LH, same hormones that come from the brain, just at higher doses than the brain would normally see them, and typically in a different time in your cycle than your brain would normally see them. So we're trying to override the normal brain-ovary communication that exists to just have you ovulate one baby at a time, because you're not supposed to have like 20 babies, or ovulate one egg at a time because you're not supposed to have 20 babies at one time. So when we think about this, and we're saying this month, I'm going to get all these eggs to grow, take them out of my body, not tapping into the vault. So importantly, you're not going to harm your future fertility later. You're not going to run out of eggs any faster. There's no higher rate of infertility after going through these processes. But we're trying to give you the opportunity. I always say the time to freeze your eggs is the time you're thinking about it. We can't rewind the clock. It's never wrong to get tested and to learn more about the process. If we look medically at when are you going to have the highest odds of success, medically, you would say if you're age 32 to 33 and you're not ready to get pregnant, that's a great time to freeze your eggs, because you're still going to have a high number of eggs, good quality of eggs, and you'll have to do less cycles to get the desired outcome. Does that mean that it's not worth doing at 36, 38, 40? Absolutely not. It's just a little bit of a different game. And we really have to personalize medicine a little bit more then, meaning your medical conditions, your egg count, your exact age, your family goals, they are going to change what the process might look like for you. The older we are, the more kids we want, the increase the chance that we have to do more than one round or more than one cycle, which might mean I might have to get the eggs from this month and then turn around and get the eggs from next month. That ultimately is fine. It's not harmful for your body, but it's emotionally, physically, financially takes more, right? And we don't always have an unlimited amount of those resources. So it does become an easier journey to walk or a higher ROI on that one cycle investment the younger you are. But that doesn't mean it doesn't work later. I mean, I've had women in their 40s freeze eggs, and have success and have babies now. So I don't want to say that it's, oh, it only works when you're young. But we have to know that a lot of data is looking at, cost effectiveness and when does it make sense? And they're comparing the odds of you getting pregnant at a certain age to using frozen eggs. And so it's a very complicated picture that really get tested, get an egg count, get somebody who's going to walk you through what that data looks like for you, because not every egg is going to fertilize, make it to an embryo, implant and become a baby. So there's a lot of loss in that process. And it's always best for you to really get that personalized data for yourself.
I'm so glad that you said that. I have a friend who will remain anonymous, but, she went to her doctor. She's 36 years old, and they kind of said, like, it's too late to freeze your eggs. This is just like not a good idea. And it kind of left her defeated. And so I think if anybody's listening to this, just find somebody who's going to listen to you, to walk that path with you, to do deeper testing, because you never know really what's possible for you. And that's why I'm so passionate about the work that you do.
Oh, well, thank you. And I'll say this too, when egg freezing was just coming off experimental and we only had 40, 50% success, we were counseling patients differently, right? There was a huge push to make embryos over eggs, especially for older women. Or we see women who maybe froze their eggs back then at an older age, and now they're not having success and they're being loud online about their bad experience. And anytime somebody shares their fertility experience, whether it's good or bad, like, props to them, because it's vulnerable and you don't owe anybody an explanation about your medical history. But our words have a big impact, whether we say that, oh, fertility is all manifestation, or, oh, egg freezing's a scam and a waste on your money. Somebody may hear that on either end and make a decision which severely impacts their life, not rooted in the truth. And so I think that's important to say, yeah, one person could have an exceptionally good or an exceptionally bad outcome, and both those things are normal. And yet neither of those are the true average of what most people will experience. And so don't let one person's story change what you may want for yourself, or going and get the data from somebody that you trust on your own to make your own decisions.
This has been such a great conversation. We're so excited for your book. If, somebody's listening, they want to learn more about you, they want to learn about your book, can you just give us a little more information?
Absolutely. So I'm online at Natalie Crawford MD on Instagram, on TikTok. You can find more about the book at nataliecrawfordmd.com/book. The book is called The Fertility Formula. So you'll also be able to look for it anywhere where you want to buy books, on Amazon, Barnes and Noble, all the places. And I also host the As a Woman podcast, which has lots of great fertility education, just like this episode has been.
Yay. Oh, thank you so much, Dr. Crawford. I'm so glad you wrote a book and you do all this content, because we barely touched. We're like tip of the iceberg in this conversation. So I'm excited for people to get to know you and learn more about your work. But thank you for joining us today.
Thank you guys so much for having me and holding space for this discussion. It's so important.